President Uhuru Kenyatta is set to meet all 47 governors tomorrow in a meeting aimed at assessing the capacity of counties to combat the rising cases of COVID-19. And as Dorcas Wangira reports, all the 47 counties are far below the target bed capacities to handle an upsurge of infections should it occur.
Prompted by fears of overwhelmed facilities, the government has considered home-based and community care for asymptomatic patients in accordance with WHO protocols. But just how prepared are counties to deal with the rising numbers of new cases? Siaya County was recently under the spotlight for having just 10 isolation beds. Tuesday, the 71-bed Alupe Isolation Center had 210 patients. The Mama Lucy Hospital and the South B Level 3 Hospital in Nairobi had to be designated as COVID-19 isolation facilities to deal with the rising numbers in Nairobi.
The healthcare system will most definitely be overwhelmed. So the hard question to pose here is whether Kenyans are prepared to nurse COVID-19 patients in their homes.
The government has directed that each county must have at least 300 isolation beds. On Wednesday, June 10th, the president and the governors will have a meeting to see the gaps and the interventions that must be put in place to meet the 300 beds minimum threshold. Nakuru has already identified the Nakuru Level 5 Hospital outpatient wing currently being constructed, where 500 beds will be placed in 2 months' time. Currently, the Nakuru Level 5 isolation facility has 30 beds, 40 ventilators, and an additional 20 ICU beds. 300 beds are still not enough for the county's huge population of over 2 million people. The county is making preparations for an estimated 1,000 new cases in the event of an upsurge.
So our plan is beyond the 300, we are targeting about 1,000. And we are working together also with private hospitals, because when it comes to healthcare, there are no private patients and public patients.
The Kenyatta University Referral Hospital, with a bed space of 456 Tuesday, had 263 patients. The shortage of testing kits to carry out tests after the isolation period is a major factor that keeps patients in the isolation wards longer. The facility is now carrying out its own tests and observing WHO protocols of discharge for asymptomatic patients. This is helping free the much-needed bed space.
We have dispersed Kenya shillings 5 billion to the counties in order to assist them increase their healthcare capacity in view of this pandemic, but to build the necessary health infrastructure for such an undertaking.
A Kenya Medical Practitioners and Dentists Council proposal dated 7th April 2020 lists identified isolation centers in each county. The 460 isolation centers have the capacity of 138,220 isolation beds. The proposed centers include high schools, universities, teachers training colleges and other training institutes. The 47 counties are grouped in 10 regional clusters. The North Rift region with a bed space of 15,001, the South Rift region with 16,453, Nyanza with 22,619, Nairobi 1,042, Central 22,763, Upper Eastern 12,384, Lower Eastern 16,607, the Coast region 14,101, the Western region 11,632, and the Northeastern region 5,618. The Wednesday coordinated summit will not just review the matter of isolation beds and centers, but also the containment measures put in place to flatten the curve. Dorcas Wangira, Citizen TV, Nairobi.